Many men are troubled by problems with urination as they get older. These problems include having to urinate very frequently during the day, having to get up at night to urinate, finding that the stream of urine is very weak, feeling that they haven't emptied their bladder fully, dribbling or dripping a lot after urination, finding that the stream stops and starts a lot during urination, and being unable to delay going to the toilet when the urge for urination comes. This collection of symptoms is now commonly referred to as lower urinary tract symptoms. For a man seeking relief of this troublesome condition, thankfully there are many options available. For people who are not greatly affected, medical therapy in the form of tablets may be appropriate, and this can do enough to improve your flow so that your symptoms are reduced. However, this is not suitable for all men. There are various surgical options available also. The traditional surgical approach to this problem has been with an operation called a TURP, or TURP. This stands for transurethral resection of the prostate. Under a general or spinal anesthetic, pieces of the prostate gland are removed via the urethra by an instrument which is passed down through the penis. This has been an excellent operation and has served the community well for over 40 years. However, it is not without its side effects, bleeding is not uncommon, and the patient usually requires to be in hospital about 2 to 3 days after their operation. One of the areas that I have been specifically involved in and will talk briefly about is the use of Greenlight laser technology for treatment of the obstructing prostate gland. Greenlight laser prostatectomy, or to give it its correct name, photoselective vaporization of the prostate, or PVP, is a system whereby laser energy is used to replace the cutting effects seen in traditional TURP surgery. Under general or spinal anesthetic, an instrument is passed down through the urethra and a special laser fibre is passed through this. Extremely powerful laser energy is then passed down through this fibre and reflected onto the prostatic tissue. This laser energy interacts with the prostatic tissue by vaporizing it down to its atomic components. One of the great advantages of this is that not only does it vaporize tissue, but it also coagulates or seals small blood vessels in the tissue as it travels through. This significantly reduces the amount of bleeding associated with this surgery. The amount of time that a catheter is left in is also reduced, and most patients would not have a catheter in their bladder for more than 12 or 16 hours. Patients can have this procedure performed as a day case or with one single overnight stay. Usually they are discharged the morning after surgery without any catheter in their bladder. One of the significant advantages of the ability to stop any bleeding is that patients who are on blood thinning medications such as warfarin, clopidogrel, which is also known as Plavix, or aspirin, can undergo this surgery without having to come off their medications. This can be of significant advantage for patients who have to remain on, for example, warfarin or Plavix. Usually within a number of weeks, the patient will notice their symptoms improving significantly, and the results to date with this system have been excellent. It is one of the areas that I have greatest interest in, and have spent a lot of my time involved in research in relation to this procedure. Patients are usually seen back in the rooms about 8 weeks after their surgery, and the majority of them have had very good resolution of their symptoms. In my opinion, this is an excellent option for anyone considering surgery of the prostate gland for benign conditions. It significantly reduces the risks associated with surgery, reduces the amount of time that a catheter is left in the bladder, and reduces the inpatient hospital stay.